I was watching TV one day and noticed that straight lines on the screen had gone wavy. I also noticed a dark spot in my vision. I was worried, so I made an appointment with my opticians. The person at my opticians did all the usual tests, like checking my vision and looking into my eyes. But they told me I needed further tests in the hospital as they found signs of possible wet age-related macular degeneration. They explained this can develop when blood vessels grow into the macula at the back of the eye and then leak fluid, which can cause damage. I was worried about further damage and if I would lose my sight, so I was glad to be referred to a hospital. They referred me to a retinal specialist and I got a letter for an appointment within 2 weeks. In the eye clinic, I had my vision tested again after some drops were put in my eye to dilate my pupils. I then had some scans on my eye, which included a test called OCT angiography, which shows where the problems may be in the blood vessels. Once the test was finished, the doctor looked at the results and told me they showed leakage, so I would benefit from some treatment. They explained this involves a series of injections in the eye with a drug that stops the growth of blood vessels that leak. I was nervous about the idea of injections in my eye, but the doctor reassured me that the eye would be numb and the injections are done from the side so I would not see the needle. They also explained all the risks and benefits to me so I could make the decision. I decided it was worth doing and signed a consent form in the clinic. They told me that here at my hospital I could have the treatment on the same day, which was great as then I didn't have to come back another day. I was seen first by the nurse who asked me a series of questions to make sure I was suitable for the treatment. They then put anesthetic drops in my eyes and asked me to sit in a reclined chair. Once my eye was numb, the healthcare practitioner cleaned the skin around my eye and inserted a small clip to stop me blinking during the procedure. They asked me to look to one side and give an injection into the opposite corner of the eye. The injection only took a few seconds. It wasn't painful at all. I just felt a bit of pressure on my eye. The whole procedure only took about 20 minutes. After the injection, I had my vision checked again and was given eye drops to take home. I was told my next appointment would be in 4 weeks. I was told also to watch out for any persistent new issues with my eyesight, like loss in my vision, straight lines that appear wobbly, or patchy vision, and to contact the eye clinic straight away if I had any of these problems. My vision has already improved a lot, so I'm really glad I went to the optician when I did.